welcome to Lyme Support Network Podcast, hosted by Holistic Therapy Tribe. In each episode, we talk with someone from the Lyme community, like a doctor, warrior, coach, or an advocate, to hear their personal story and insights. Today, our focus is on a Lyme doctor. Our guest is Darin Ingels. Doctor is a leading expert on Lyme disease, naturopathic doctor, and author of Lyme Solution. After overcoming his own battle with Lyme, Dr. Ingels now helps others navigate the complexities of Lyme disease with his holistic approach to healing. In this episode, we will discuss the early signs of Lyme, practical steps to take after a bite, and his step-by-step treatment plan for recovery. Dr. Ingels, welcome to your podcast.
Great. Thank you so much for having me.
Today's podcast is divided into two parts. In the first part, we will dive into the basics of Lyme disease or covering essential information that everyone should know. In the second part, we will explore your book, The Lyme Solution, and discuss the key insights it offers to Lyme disease recovery.
Great.
Thank you, doctor, for joining us. So very, very basic question for a newbie, so who don't know what is Lyme. So basically, what is Lyme and how do people get it?
Sure. So Lyme disease is actually due to a bacterial infection that's primarily transmitted through a tick bite, and it's a very specific kind of tick called the Ixodes tick. And when the tick bites you, it has this bacteria in its saliva, and then it gets into your bloodstream and then can cause various type of symptoms. So, the classic Lyme symptoms that we typically think about is what's called an erythema migrans rash or a bullseye rash. That if you've ever seen the logo for the store Target, it kind of looks like that, where you've got these concentric rings of red and clearing. That is a hallmark of Lyme disease. Another very unique characteristic is what we call migratory joint pain, where one day your right shoulder hurts and then your left knee and then your right ankle, and you get this joint pain, but it kind of seems to move throughout your body. But there's over 100 different symptoms associated with Lyme disease. It can cause headaches, joint pain, what we call neuropathy, which is like numbness and tingling, often in your hands and your feet, fatigue. That can cause mood changes, behavior problems. It can cause brain fog, cognitive impairment. And again, there's just a kind of a long laundry list of symptoms. But, there's what we call acute Lyme disease and chronic Lyme disease. And people with acute Lyme disease are typically very sick. You can get very high fever. You can almost feel like you have a really bad flu. And often, people get these symptoms and they go to the doctor, and the doctor doesn't think to test for Lyme disease. And so they get sent home saying, well, you just have some mysterious viral illness and it'll just go away on its own. And often people don't get appropriate treatment at the time. And again, if it doesn't get treated in a proper time frame, it can become persistent. And then people go on to have chronic symptoms.
Mm. Okay. So does everyone get a bullseye rash? If not, what else should you look for?
Yeah, so the bullseye rash, according to the CDC, they say that 60 to 80% of people get the bullseye rash. If you look at the research, it suggests it's less than 40%. And those of us in clinical practice will actually tell you it's probably less than 20%. So for those who do get the rash, it's pretty much and hands down, slam dunk, we know you've been exposed to Lyme disease, but more often than not, people do not get the rash. So as I mentioned earlier, when you start getting this, for me, the big red flag is when you get a collection of arthritic symptoms and neurological symptoms. The combination of two, there aren't too many things out there that cause both. So when people have, joint pain and muscle aches and body pain, but then they've also got, all these neurological symptoms of dizziness and headaches and brain fog, and all of a sudden they just, they can't remember things. That would be a big red flag that there might be something like Lyme disease.
When do symptoms start after a tick bite?
It can be anywhere from a few days up to several weeks. I have some patients where, as far as we can tell, they were exposed perhaps even months or even years earlier. It is possible to get a tick bite that carries Lyme. And at the time, if your immune system is very healthy and robust, you may never get any symptoms. We have pretty compelling evidence that the organism that causes Lyme, it's a bacteria called Borrelia. That Borrelia, again, can stay in your body in the dormant phase and potentially stay there for many, many months or even years. But when your immune system becomes compromised, then it becomes active and you start to become symptomatic. So again, if you look at the research, it suggests that symptoms after an acute tick bite can be anywhere from a few days up to 30 days. But again, in clinical practice, we've seen people where their symptoms don't start till much later.
So we had a Lyme patient. They had around 8 years gap, and only after that they found it was tick. 8 years it was there.
Well, and I think it's a very common problem too, that again, when people again start to get this collection of symptoms, again, they go to the doctor, they see the specialist, they get blood tests done, they do MRIs, they do all these, other types of diagnostic things to try and figure out what's going on. But either they were never tested for Lyme or other tick-borne illnesses, or the timing in which they do the test wasn't right. And they just missed that window where that test might be positive, at least according to conventional CDC standards. So again, underdiagnosis, misdiagnosis is extremely common.
So if you find a tick on your skin, what are the exact steps to remove it safely?
Yeah, so the old wives' tale of burning it off with a match and dousing it in Vaseline, please don't do any of that. It actually, if you kind of scare the tick, if you want to think of it that way, it might inject more of its saliva into your bloodstream once it's attached. So the proper way is to get a set of tweezers and put the tweezers very close to the skin where the head of the tick is embedded. Grab it gently, and you just want to pull straight up with gentle force. Over time, the tick will eventually let go. It can take several minutes sometimes to get the tick to get out of your skin. Don't just rip it off. Don't yank it out. You need to be a little bit patient with it. But if you just gently grab it, keep pulling, it'll eventually come out. And if you're able to pull the tick out, you definitely want to save the tick and send the tick out for testing. Although, again, testing isn't foolproof. There are plenty of labs around the country that will test the tick, find out if the tick carries everything or anything. And then again, it gives you and your doctor at least a chance to understand what the tick might be carrying. And so if you know it's positive for Lyme, Bartonella, Babesia, other types of infectious agents, that gives you good information to know how to proceed with treatment.
So the information after the testing of the tick, so how useful it will be? Or in what way it will be used?
Well, I think in terms of depending on how you decide to treat it, we know that, with either antibiotics or with herbs, some antibiotics and or herbs work better for Lyme. Some are better for Bartonella. Some are better for Babesia. So certainly it gives us healthcare providers the opportunity to select the right thing for you. And again, sometimes it's not just Lyme. I mean, it's very common to get co-infection where it's Lyme plus Bartonella, Lyme plus Babesia, Lyme plus Mycoplasma. So, understanding what you've been exposed to, again, gives us good information to select the right antibiotic or the right herbs to start your treatment.
How long does a tick need to stay to spread the Lyme?
That's a great question. And it's a bit controversial. The CDC says it needs to be on for up to 24 hours. Again, if you look at the research, it suggests that maybe 6 hours or less. But if we kind of put Lyme to the side, we certainly know that other infections can be transmitted as quickly as 15 minutes. So it's not even just about Lyme disease. We also worry about all these co-infections. Bartonella can get spread faster. Babesia can be spread faster. So we know the sooner you can get the tick off you, the less likely you are to have a problem. But again, I don't know that we have any really good, reliable data for Lyme specifically. Again, it seems that it's certainly not 24 hours. It's probably much less than that. And it could be as little as 6 hours or maybe even less.
So how reliable is blood test in the first 2 to 4 weeks after a bite?
So the CDC criteria for blood testing, I think people need to understand that this test was never designed to be diagnostic. It was designed to monitor people who had known Lyme disease. So these are people who had the bullseye rash and all the classic symptoms. Back in the day when this test was developed, they wanted a way to monitor people over time. So if you look at the CDC's website, Lyme disease is a clinical diagnosis. It's based on your symptoms. It's not really based on lab work. So any doctor who's using the lab solely as a criteria to say you do or do not have Lyme disease, that's unfortunately not accurate. However, the sensitivity of the conventional testing. So what they do is what's called a two-tier test. The first test is a Lyme antibody screen. If that test is positive, it reflexes to what's called the Lyme Western blot or immunoblot, which measures a bunch of different antibodies against the Lyme organism. And then again, if that test is positive, they say, okay, you have Lyme disease. We know the sensitivity of the Lyme screen is somewhere between 43 and 46% sensitive. And what that means is that it only picks up 43 to 46% of people who have Lyme disease, which means it literally misses more than half of the people who do have Lyme disease. So unfortunately, it's not been a very accurate test. False positives are very rare. False negatives are very common. So again, depending on when your tick bite occurred to when you're doing the testing, again, it can take up to a month to make antibodies. So if you're doing that test anywhere in that first month after your tick bite and it's negative, it certainly doesn't mean you don't have Lyme. It could be that it's just taken that long for your immune system to generate enough antibodies to pick it up on a test.
Yes.
So if we know that you were bit by a tick, we usually wait, a week or two to test you by blood. You could test right away, but if it's negative, you would definitely want to repeat 2 or 3 weeks later to see if it truly is negative. But again, your clinical symptoms, and particularly for people who have a known tick bite where they pulled the tick off themselves, and particularly if they're able to identify it is a deer tick, the ixodes tick, that itself would warrant treatment. We can't wait for your antibody test to be positive. We want to treat as soon as possible. So the general rule is if you pull a tick off you, and particularly if you know it's a deer tick, we treat until proven otherwise.
If an early test is negative but symptoms persist, what should the patient do next?
Well, again, we treat people, we don't treat pieces of paper. So if you've got clinical symptoms that suggest Lyme or one of these co-infections, the general rule is to treat empirically. Again, if you've got evidence on paper that you've had exposure, which is all the Lyme test really tells you, then that would sort of add more credence to warrant treatment. But again, we really base it on symptoms. And so it's great when the test comes back positive, but knowing that it's not a very sensitive test. Now, in saying that, there are some labs I think that do better testing than your conventional reference lab like Quest or LabCorp. So we've got labs like medical diagnostic labs in New Jersey, IGeneX and Palo Alto and Galaxy Labs. They all do much better testing. The sensitivity of their test kits are better. So you're more likely to get a positive result if you're using one of these specialty labs. But again, most people are using the conventional reference labs in their local area. And again, false negatives just happen to be very common. So again, we treat really based on symptoms.
So what kind of doctor should someone with a new symptoms try to see first?
Well, ideally, you'd be able to go to your primary care doctor and they would do the proper workup. Depending on where you live in the world, I used to live in Connecticut, and for people who don't know, Lyme disease is named after Lyme, Connecticut. That's where they first discovered it in the late 1970s and ultimately figured out in the early 80s. But again, if you live in the central part of the United States, where most of those states don't believe Lyme really exists, your doctor is probably not going to be very likely to look for it. If you live in New England or in the central part of the country, they're more likely. I lived in Connecticut for almost 20 years, and I've been in California now for about a decade. And I was shocked to learn that California doctors here don't look for Lyme disease at all. Yet even the CDC says California is the 5th fastest growing state for Lyme disease in the country. So there's still a level of ignorance in the medical community about testing for Lyme disease and these co-infections. So if you are suspicious, you can always ask your primary care doctor to run a standard Lyme test through a regular lab. If it comes back positive, if it comes back negative and you're still suspicious, you're probably going to want to get in the hands of what we call a Lyme literate doctor, just a doctor that has a little bit more of an understanding of Lyme disease, the criteria for diagnosis, and they are more likely to get you the help that you need.
So for early Lyme, What does an standard antibiotic treatment typically look like?
Well, conventional treatment for acute Lyme disease is typically with antibiotics. The CDC recommends using either doxycycline, azithromycin, or amoxicillin, and that's really just for Lyme disease. And they'll recommend 14 to 21 days of treatment. We know that Lyme is an incredibly slow-growing organism, or Borrelia. Most bacteria in your body replicate every 10 to 15 minutes. Lyme replicates every 1 to 16 days. It's incredibly slow. So the slower the growth of the organism, the best time to treat a bacteria is when it's replicating. And so the slower it replicates, there's just less opportunity to basically kill it at that phase. And depending on the antibiotic that you use, so doxycycline is the one that most doctors use, and that's what's recommended by the CDC. However, doxycycline actually doesn't kill anything. Some antibiotics work by not necessarily killing the organism, but they interfere with the organism's ability to replicate. So it basically stops the replication, but it still depends on your immune system to get rid of the infection. So if you've got any kind of underlying immune dysfunction, your capacity to clear that organism may be compromised. And again, I don't think the government really kind of recognizes that not everyone's immune system is the same. So if you've got a drug like amoxicillin that actually does directly kill the organism, it breaks down the cell wall of the bacteria, it's a little bit of a different mechanism. So this, conventional ideology of using, one antibiotic for 14 to 21 days, most of us in the Lyme community who do a lot of this feel that that's not sufficient. The treatment is not basically appropriate and long enough. So even if you're going to use antibiotics, we usually use antibiotics in combination. We'll use an antibiotic to interfere with the replication. We'll use another antibiotic to break down the organism. And we would use it probably anywhere from 6 to 8 weeks. So it's a much longer course of treatment. So, the longer the course of treatment for slow growing organisms is a better course of action. And to put this in perspective, if someone gets tuberculosis, which, fortunately we don't see a lot here in the US anyway, TB, Mycobacterium tuberculosis, is a very slow growing organism as well. It replicates every 15 to 20 hours. Yet doctors will give a TB patient 3 heavy duty antibiotics for 9 to 12 months. Yet they'll only give a Lyme patient antibiotics for 14 to 21 days. Yet Lyme is more slow growing than tuberculosis. So it just doesn't really make a lot of logical sense why we are so okay with just using such a short course of treatment. And we know from the research that 20% of people who get treatment for acute Lyme disease are treatment resistant, which means they go on to have persistent or chronic symptoms. And this idea of chronic Lyme disease, again, has been a bit controversial, but again, those of us in the field recognize it. We know it exists. I'm living proof. I was a chronic Lyme patient, and I had been through, months and months of treatment. So it definitely does happen. We've got a lot of research corroborating that. So again, it requires often a longer course of treatment.
So are there basic diet changes that can reduce inflammation for Lyme disease?
Diet changes?
Yeah. So that can reduce the inflammation.
Yeah. I learned just from my own personal experience, and then having worked with thousands of Lyme patients over the years, what I promote is really what's called an alkaline diet. And it's nothing I invented. It's been around for decades. But the idea behind it is that when you eat certain foods, as they break down in your body, they can make your cells acidic, they can make them alkaline, or they're kind of neutral. And we know from cell physiology that, with the exception of your skin, your stomach, your bladder, and for women, the vaginal area, those are very acidic to help protect against outside invaders. The rest of your body and your cells and even your bloodstream is alkaline. So the more alkaline we make your cells, it gives the cell the best opportunity to repair, to function the way it's supposed to, and ultimately reduce inflammation. And at the end of the day, a lot of the symptoms that Lyme patients experience is inflammation in the joints, inflammation in the brain, inflammation in the nerves. So as much as we can control inflammation, we can really help, control symptoms. And, what I also like about an alkaline diet is that it's not a difficult diet for people to follow. It's not like, okay, you can't eat all these different foods. It's really about being selective of the kind of foods that you do eat, so that we make sure that you're eating plenty of the foods that make your cells alkaline, and really kind of staying away from the foods that make your body more acidic.
How do early symptoms differ from common flu and virus or common flu?
Well, again, there can be a lot of overlap. I think the wandering joint pain, that's a little bit different. People who get flu tend to get muscle pain, more like in the belly of the muscles, kind of if you push on the middle of your arm, your thighs, that kind of hurts. Where Lyme tends to be a bit more specific for the joints. Your joints hurt when you move. The fever associated with acute Lyme disease is often higher than what people get with the flu. Um, and the neurological impairment tends to be worse with Lyme than what you would see with the flu. When people are getting brain fog and memory problems and neuropathy, that's not typical for flu. Flu tends to be, your fatigue, you get body aches. Those are kind of the hallmarks. And again, you get often a low grade fever. Again, when you get a higher grade fever, you got more joint pain and more neurological symptoms, especially neuropathy. That would be a bigger sign that it might be related to a tick-borne infection.
So what early signs suggest a possible co-infection?
There's a lot of overlap with some of these co-infections. So that's why when we do testing, we usually test for more than just Borrelia. We test for other infections because there is a lot of overlap in symptoms. There are a few things that are a little bit unique. For example, Bartonella can cause these things that we call tracts. They look like stretch marks on your skin, but they're completely unrelated to any kind of weight changes. And they tend to be perpendicular to the natural folds of your skin. So we see this often in some of the younger people where you'll see them across their lower back, sometimes across the hips and the buttocks area or the thighs, sometimes the shoulders. And again, it's unrelated to weight changes. That's kind of unique to Bartonella because Bartonella really likes your blood vessels and tends to cause a lot of blood vessel issues. Bartonella also tends to cause a lot of specific foot pain, and people will complain of like this burning sensation in the soles of their feet. Lyme can cause neuropathy too, but that burning in the soles of the feet is a little bit more unique to Bartonella. Babesia can cause something called air hunger, where it's not asthma, but people feel like they just can't get a deep breath, and they're just constantly trying to get more air in. And yet you can check their oxygen saturation and everything's normal. So again, it's a feeling more than a reality of something like asthma that's causing restriction in your lungs. Babesia can also cause pretty severe migraine type headaches. Although again, when I had Lyme, I had a migraine. So again, that's not completely unique to Babesia. And then some of these other infections, there's not necessarily a lot that's unique to it. Anaplasma, Ehrlichia, Mycoplasma. Again, the symptoms are often vague and not really specific to the organism. So that's why it's important then when we're doing tick-borne testing, we are testing for the things based on your symptoms that we think you might have been exposed to. And again, depending on where you live in the world, we know that some organisms may be more prevalent than others. So you need to understand where the person lives to know the right things to test for.
Are children's early symptoms different from adults? And what should parents do once they come to know the children got Lyme?
Well, same thing with kids. Again, early treatment is still important. In kids, sometimes the symptoms can look a little bit different. It's not always as severe as we see in adults. But when I start to see a lot of like neurological change in children, again, when they're starting to not do well in school, their grades are falling, they're complaining of headaches and fatigue. Kids generally should have a lot of energy and be able to do normal kid kind of activities. And when all of a sudden you see this almost dramatic shift in their mood and their behavior and their energy levels, again, for me, that's a little bit of a red flag that, hey, maybe they've been exposed to something like Lyme. But again, acute Lyme disease in kids can look like adults. And again, if you see something that's going on for more than a week or two and these symptoms are persistent, again, most viral illnesses are fairly self-limiting. They go away within 7 to 10 days. But if you've got a child again that's complaining of joint pain, getting swollen joints, having neurological issues, again, that would be the time to test them for something like Lyme.
What should a pregnant person do immediately if they suspect a tick bite or early Lyme?
Yeah, so for women who are pregnant, we've now got good data that mothers can transmit Lyme and probably these other co-infections while they're pregnant to their baby. And if that happens, the baby can be stillborn, it can cause birth defects, or it can cause serious developmental delays in their child once they are born. So, the recommendation is, again, to treat as early as possible. Again, depending on where the mother is in the pregnancy, would kind of dictate perhaps what you do for treatment. But I think because the risk of transmission is very real and the implications can be quite devastating, I think getting early treatment while you're pregnant, although there's always a risk when you're pregnant with using any kind of antimicrobial, I think the benefits outweigh the risk.
What are the top 3 mistakes people make in the first 14 days after suspected tick bite?
Well, yeah, I don't know if I would call them mistakes. I think the biggest problem is that people just don't recognize that they might have Lyme. Again, if they didn't get the bullseye rash and they're just acutely sick, again, often they go to their doctor, they go to the ER, they don't feel well, and they just kind of get palliative treatment and then get sent home. So to no one's fault, you don't know what you don't know. And if you didn't see the tick and you didn't get the rash, I think it's important for people to understand that the overwhelming majority of people with Lyme disease never saw a tick, never had a rash, had no idea they ever had a tick bite. Ticks like the warm, moist areas of your body. So often they go to places that you can't easily see. I got bit on the back of my leg. I would have never had known, except as I was ready to go to the hospital, someone else noticed I had a rash on the back of my leg. I didn't see it, somebody else did. So again, if it gets behind your knee and your armpit, behind your ears and your hair, you would have no idea. So unfortunately, for acute Lyme disease, if you live in an area that's endemic for Lyme, and again, you start to get this weird collection of, neurologic and arthritic things, I would hope that your doctor would test you right away, knowing again that you might be in that window where your antibody test may not be positive. But at least they should be following up and at least checking to see if you've had that exposure. But if you live in other areas in the world where Lyme isn't necessarily known to be endemic, unfortunately, more often than not, the doctors just don't do the proper testing and you just don't get the right diagnosis.
What are the most important Lyme myths to clear up?
Well, I think the biggest myth is that, 2 to 3 weeks of antibiotics is enough. For most people, it's not. I think the other myth is that Lyme isn't chronic. That's absolutely untrue. And we've now got literally millions of people in the United States alone living with chronic Lyme disease. And this myth that, it's just an easy infection to treat, it can be incredibly difficult. And so, people need to be really persistent with their treatment. They need to stay consistent. And particularly those dealing with chronic Lyme disease, up and down in your symptoms during treatment is very normal and expected. So you just kind of have to stay with it. Again, I can speak from my own experience. It took me really 3 years after my initial tick bite to get to a point where I felt like I was symptom free. And that was doing 9 months of antibiotics and 2+ years of herbs and a lot of other things. So you just have to be a little patient and a bit persistent to ensure that you've got your body to a good state of health that it can manage it on its own.
So what prevention steps really make a difference? Like clothing, repellents, tick checks. So which one is
Well, I think one of the best things people can do, again, particularly if you live in a Lyme endemic area, we've got research that if you spray your shoes and socks with a chemical called permethrin, permethrin is very toxic when it's wet, so you have to be careful when you apply it. You want to wear masks and gloves, be outside in the open air. But if you've got like a pair of shoes and some socks that you're going to dedicate to be your outdoor shoes and socks, spray them. Once it dries, it's actually very safe. But we know that by spraying your shoes and socks with permethrin, it reduces your risk of a tick bite by over 70%. And that's huge. Obviously, if you're going to be out in an area where there might be ticks, wearing long clothing to help protect the tick against, biting your skin. You can also use, there's some really great natural essential oil tick repellents that have things like, eucalyptus oil, thyme oil, clove oil, and usually it's a mix of all these different essential oils, but that's very safe to apply on clothing. You can apply it on your skin. It's safe for children and pets. So I'm in favor of using that, applying that, in addition to using the permethrin treated shoes and socks. Again, you can spray it particularly in your lower part of your body because that's more likely where the tick's going to get entry to you. And then, yeah, doing tick checks, especially for kids. If they've been outside playing in the yard, when they get in, strip them down, check all the cracks and crevices of their body because that's where the ticks like to go, and just make sure they haven't been bitten. Because again, the sooner we can get a tick off, the less likely they are to have a problem. And then even around the house, you can do something called tick tubes. And you can make your own tick tubes. There's a lot of great YouTube videos on how to make your own. You can buy them off of Amazon and places like that, but you can put them around the house. And basically, it's a way of just trapping a tick, and it traps it, kills it, so it doesn't keep going around the yard to cause problems. So tick tubes, again, very inexpensive, easy thing to do to try and help protect against ticks. I don't find that spraying your yard for ticks is very effective. I've seen people spend lots of money in these different companies, and often the chemicals they use are very toxic. They're not safe for you, your kids, your pets, especially right after it's been applied. I don't think they work terribly well. So I would rather use these other measures to protect you and your family.
If a listener suspects early Lyme today, what is your simple 48-hour action plan?
Yeah, treat until proven otherwise. So, in my practice, we use a lot of herbs for people who might be concerned about using antibiotics because of what it does to your gut microbiome, what it can do to you, and other side effects. That's fine. I mean, if there isn't a time to use antibiotics, that definitely is the time to do it. So I have some people that will elect to use antibiotics, again, until we have an opportunity to test them, until prove otherwise. Otherwise, I think herbs work incredibly well. So I'll usually start my patients on herbs until we get an opportunity to test them to find out if they've had that exposure.
Your book, The Lyme Solution, provides a step-by-step recovery plan. Could you briefly explain it?
Yeah, so it's really a 5-step plan, and it's designed to kind of cover the totality of everything that Lyme does to your body, because it's really more than just treating the infection. I think Lyme is an incredibly common organism. I think a lot of people get exposed, but not everyone gets Lyme disease. So what's the difference? I think we saw this with COVID, right? There were some people that got a sniffle and other people that died. I mean, there was such a dramatic difference in reactions. If we believe that the virus was relatively the same at any one point, why were we seeing such dramatic differences in how the virus affected people? I think it's the terrain, it's the individual person, it's their gut health, it's their immune health, it's how well they take care of themselves, it's comorbidities. So we want to do everything else to get your body healthy, get your immune system healthy. So again, your body can manage it on its own. So it's a 5-step plan. The first step is really about diet. And as I mentioned, I promote an alkaline diet just to help, reduce acidity in the cells, get inflammation under control. And that is really the first step. The second step is the gut. Your gut is responsible for up to 80% of your immune function. So anyone who's got any kind of underlying gastrointestinal problem, chronic constipation, diarrhea, gas, bloating, whatever it might be, heartburn, reflux, if your gut isn't functioning well, there's always the possibility that you're getting leaky gut, you're getting a dysfunctional immune system. So we want to make sure that the gut is optimized and functioning well. And of course, diet and gut kind of go hand in hand, because what you put in your mouth very much is going to influence the health of your gut. So getting that squared away. The next step is targeting infection. So again, I promote primarily using herbs in my practice because I'm a naturopathic doctor by training. I have a lot of experience using herbs. I find that they are very effective at helping deal with the Lyme and all the co-infections, where we don't see this big reaction in your gut microbiome like we do with antibiotics. We know that long-term antibiotics can damage your mitochondria, which are part of the cell that literally help with cell repair and energy, and the herbs don't interfere with any of that. So we want to have a select number of herbs to target Lyme and or co-infection. The fourth step is dealing with toxicity. We know that various toxins, again, can undermine your immune system, make your cells sick or sicker. So mold, mycotoxins is probably the one thing that imitates Lyme more than anything else out there. And we find a lot of people who've been dealing with Lyme disease, if they get exposed to mold or mycotoxins, they are sicker. And again, clinically, there's a lot of overlap of symptoms of mycotoxicity and Lyme disease that's hard to differentiate one from the other. So we want to make sure that people don't have that kind of toxic exposure, that you don't have an occupation where you're around petrochemicals or pesticides, benzene, toluene, these kind of things. All these kind of chemicals, again, can be harmful to your body. So cleaning up your environment as much as you can, getting your toxic body burden down as much as possible, all helps. And then the last part is really about lifestyle. So this is sleep, this is moving your body, this is stress management. So ensuring that people get good quality sleep. When you get that deep sleep, that's when your body repairs itself. That's when you detoxify. That's when all that really good restorative stuff happens. And the more you miss of that window, the harder it is to get better. And of course, moving your body to help your lymphatic flow, to get your blood flowing. That's good for your physical and mental well-being. And, when people are chronically sick, it's stressful. It's stressful on you. It's stressful on your family, stressful on your friends. So as much as you can manage your stress in whatever way that is, that's just part of the whole of getting you, healthy again. So, we're making sure that we kind of check all the boxes and all these different pieces, because if, we only focus just on one and not the rest of them, it's just harder to get over that hump.
So from your plan, which actions matter most in the first 14 days after a suspected bite?
The first part really, again, is targeting the infection. The earlier we start antimicrobial therapy, start getting that organism under control, that is really our first priority before we start moving into some of these other phases. So absolutely, we need to make sure that someone's on some element of antimicrobial therapy.
Now, what simple diet do you recommend early on? Why?
Well, the simple diet, it may take people a while to kind of move into an alkaline diet, and certainly will take time for that to start to shift your cell pH. The low hanging fruit is just get rid of the junk food. Anything that might make your cells more toxic and certainly isn't feeding your cells in a healthy way. Junk food, fast food, processed food, sugar, all these kind of things are a detriment to your cells, detriment to the human body. So I would cut all of that out as quickly as possible. Make sure you're eating, organic as much as possible, whole foods, unprocessed foods. That's really the simplest, easy thing for people to do.
Mm-hmm. So gut health is a main focus in your book. What are 2 simple steps anyone can take to start with?
Yeah, if you've been dealing with any kind of gut issues, I'm always a fan of testing the gut to find out specifically what's wrong, so that we're not just throwing a bunch of pills at you to see what sticks. But again, if you don't have the opportunity to do that, there's some very simple things like, glutamine is an amino acid that's very nutritive to your small intestine that can help with repairing leaky gut, which a lot of people have. Some sort of omega-3 fatty acid, fish oil, it's anti-inflammatory, it lubricates the gut. It's important for your cell membranes. Pretty much anyone can take fish oil and it's safe. Digestive enzymes, if you've been suffering particularly from like gas and bloating and maybe constipation, that can be incredibly helpful to take with every meal to ensure that you're breaking down your food appropriately. Probiotics are, generally very benign for people. And again, feeding your gut with healthy bacteria can be very useful, not only in perhaps replacing what might be deficient, but also we know that probiotics are very important immune modulators. So a good probiotic can be very helpful too.
So what detox steps do you recommend for beginners? What is safe and what is not safe?
Well, I think, detox should be something that people think about as a long-term thing and not something you just do for a few days. We're all exposed to toxins. I don't care where you live in the world, it's everywhere. So think about things that you can do on an ongoing basis to help facilitate what your body will naturally do. So the easy things, you can do things like dry brushing at home as a way to help improve your lymphatic flow. I'm a huge fan of sauna. Sauna is not always easy for people if you don't have a place to go and you don't own a sauna. However, it is probably one of the most effective ways to mobilize toxins out of tissue that doesn't involve taking a pill. So for people who can get into a sauna, particularly an infrared sauna, it can be a very effective way to get rid of pretty much any kind of toxin, mycotoxins, pesticides, herbicides, toxic metals like lead and mercury. All of that can come out when you start sweating. So if people have the opportunity, I think that can be great. There's a lot of herbs and nutrients that can be used. Glutathione can be very helpful for a lot of people as a way to mobilize toxins out of tissue. Plus, it's a very important antioxidant in the body. We've got a lot of great herbs for like the liver and the kidneys. Milk thistle is a very popular one that can help just promote moving things through the liver a bit more readily. Red light therapy can be helpful for a lot of people. There's something called PEMF, or pulsed electromagnetic frequency, and there's different devices that can help improve circulation, help with cell repair. So again, there's a lot of different ways, but I think, people sometimes focus so much on detoxification, like what do I need to do to get all the toxins out, which is great. But first step is limiting the toxins coming in. And that's where, again, you're being mindful about what you use in and around your home. Get rid of all the toxic cleaning chemicals, get rid of all the toxic stuff you put on your skin, shampoos and detergents and laundry soaps and all that kind of stuff. Because if you keep adding toxins in and you're trying to detoxify, it's kind of like filling up a bathtub and draining at the same time, right? It's like which process goes faster. So let's limit the influx first, and then we can focus more on getting stuff out.
How do you decide when to test for co-infections versus start treatment?
Well, we pretty much test for co-infections right off the bat because there's so much overlap in symptoms. Again, it would be difficult. I would be amiss if I only tested for Borrelia and didn't test for these other things. Because if Borrelia test comes back negative, it doesn't mean you haven't been exposed to Bartonella or Babesia or Mycoplasma or something else. So again, I typically test for the battery of the different co-infections that are certainly common to where the patient lives. And so we're usually testing for 4 or 5 or 6 different things that are common. And then sometimes, depending on where they are or what their occupation is, we might be testing for some of the more uncommon things. But again, that's where you kind of really need to understand where the person lives and what is prevalent in their area. But again, because of the 100 different symptoms associated with Lyme, a big chunk of those overlap with other co-infections. Again, clinically, it would be difficult to distinguish. So it's a good idea just to test from the get-go, check everything that's appropriate. And I'm not a fan of just going through and testing everybody for every single thing under the sun. That gets to be very expensive and not necessarily needed, but certainly for what they are exposed to in their area, that would be useful to check all of that.
In your approach, how important is gentle exercise for recovery?
Exercise?
Yeah.
Yeah. Well, I think it's the one thing that's hard for a lot of people dealing with chronic Lyme because they're tired and their body hurts. And, every time they move, again, I can speak from my own experience. When I was in the throes of acute Lyme disease, I was really tired. I felt like my back was broken. The burning neuropathy was really uncomfortable. So it was hard to move. And I was a pretty hardcore athlete most of my younger life. And it took a while, but I found that I could stretch. And so, just sitting in front of the TV, stretching, I'm like, okay, well, it's still moving my blood. It's moving my lymph a little. It wasn't a lot, but it's what I could do at the time. And then as my energy got better, okay, now I'm walking around the house. Then I'm walking around the neighborhood. And, I eventually got to a point where I studied martial arts and I got a black belt in karate. So it took several years to get to that point, but you start with what you can do. Any movement is better than nothing. And I think when people think of exercise, they think, oh my gosh, I got to go to the gym. I got to do like this big workout. And it doesn't have to be like that at all. Again, it can be as simple as I walked from the living room to the kitchen. I did a couple laps back and forth. Any movement helps. So I think about very gentle forms of exercise, things like yoga, things like Tai Chi or Qigong, stretching. It can be these very gentle, low impact kind of exercises, walking, swimming, whatever you have access to or whatever you feel like you can tolerate. The goal isn't to exercise to the point where you're wiped out for 3 days afterwards. The goal is, move your body a little bit. And then again, as you feel like you can tolerate more, you can kind of build that a tolerance so you can increase the duration, the intensity, the frequency as your body can handle it. But it's a very important part, I think, of recovery. I think it's good for your physical well-being. Certainly, it's good for your mental well-being, and it just gives you that confidence that okay, yeah, I can do more because it's so easy to get kind of stuck that my body hurts, I can't do these things, and people are often surprised that they can do more than maybe they think they can.
So, what method do you recommend for patients to monitor their progress and know the treatment is working?
Well, monitoring progress, I mean, unfortunately, it's a little bit subjective because we know that blood tests are not the best way to monitor your progress. So, Dr. Richard Horowitz has what's called the MS-IDS questionnaire. It's a multi-symptom, I forget what it stands for, infectious disease symptom. Anyway, it's a symptom questionnaire, but I'll have patients fill that out periodically because you live in your own body, and from day to day, sometimes it's like watching grass grow. It just grows very slowly, and sometimes you forget some of the symptoms you've had. So this is it's a free download off the internet. You can download the questionnaire. It's one page, and maybe once a month fill it out, and you can look to see, oh, okay, yeah, this was a little worse last month and now it's a little bit better. So keeping a diary of your symptoms might be helpful. The questionnaire is very easy. Again, with the understanding that having ups and downs is very normal. Don't get discouraged if you have a little backslide in your symptoms. I think when Lyme in particular goes through a replication phase, that's when you are more likely to be more symptomatic because now your immune system's kind of amping up to fight it. And that can happen for a lot of people every 3 to 6 weeks. So people often will see this pattern that I was doing a little bit better and then I kind of had this backslide, and then I was doing better and I had a little backslide. But eventually the backslides, they don't happen as often. They're not as intense when they do happen. And if we're doing the right things over time, again, the backslides stop completely and we kind of just get forward progress. But yeah, your symptoms are ultimately going to be your best gauge on how you're doing with your treatment.
So, what realistic timeline should a new patient expect with your plan?
I tell everybody 6 to 18 months is typical. And I know that's a very broad window, but again, it kind of speaks to the uniqueness of the individual. Everyone's different. Your life, again, we're factoring all the things that influence your health. Some people respond very quickly. I mean, I had a woman who came to see me from Arizona years ago who had really severe neurological Lyme. And in my head, I was thinking, wow, she's kind of in for a long road. And I put her on a set of Chinese herbs. And after a month, all her symptoms were 100% gone and they never came back.
Mm-hmm.
So, that was kind of the exception more than the rule. But there are some people who respond very quickly to treatment. And sometimes they're only on for a handful of months and then they feel great. And that's that. But I'd say more commonly, it's 6 to 18 months. Sometimes it's longer. I think the important thing is whatever you're doing, whether it's antibiotics, herbs, or otherwise, you need to have a realistic time frame with your practitioner of what to expect once you start a new treatment program. My expectation is I expect to see a change in 2 months. Knowing that Lyme is a slow growing organism, we should see some element of progress in 2 months. If we don't see any change at all, we're doing the wrong thing and we need to shift and do something different. But I've seen people who've been on the same treatment for 6 months, 8 months, a year, nothing's changed, and they're waiting for the magic to happen. I'm like, clearly what you're doing is not working. So 2 months is my time frame.
Yeah. So can you share one case that shows your approach from week 1 to month 3?
Month 1 to month 3. Well, one of my favorite cases, I had a woman who came to see me from South America who was diagnosed with rheumatoid arthritis. And we found out she had Lyme disease, which was probably what was causing her RA. And she had all the classic blood tests that you typically would see with someone with rheumatoid arthritis. But for like a lot of autoimmune diseases, you get a label, but you ask your doctor, well, why do I have rheumatoid arthritis? And they kind of shrug their shoulders and go, I don't know. I mean, bad luck or bad genes. And we know that Lyme and a lot of these infections can be triggers for various autoimmune diseases. So we started her on Lyme treatment. And really, in the first month, we saw a significant reduction in her joint pain. She's a runner, and she was having trouble running, so she was able to start running again. And again, we started her on alkaline diet. had her on the herbs. I put her on the same Chinese herbs that I was on that got me a lot better. We started a lot of other diet changes. I tested her for food allergies. We started dealing with her food allergies specifically. And over the course of, the next 2 to 3 months, I mean, she became a fully functional person again. And now, interestingly, I think I saw her, it's been 8 or 9 years since I initially saw her. I just saw her maybe 3 months ago, and she's basically 100% symptom free. Very interestingly, though, her blood tests still show signs of rheumatoid arthritis, although her markers have come down tremendously from when we first met. But she has no signs of RA. She has no joint pain. She has no joint swelling. She's never been on a biologic medication to suppress her immune system, and she's functionally doing very well. So I think, again, it's one of these things where she was a highly compliant, highly motivated individual, did everything that she was asked to do. And it showed pretty quickly. So, we've done various things with her over the years for various aspects of her health, but that Lyme piece got controlled pretty quickly.
When do you recommend options like herbal protocols and LDN? And what factors guide you for that choices?
So most of my patients are on herbs. Again, at this point, I've seen over 8,000 Lyme patients, and I've written probably 12 or 14 prescriptions for antibiotics. So most people get treated with herbs. I mean, for me, that's always a place to start. I think with herbs, what's really nice is that, like I said, they're less likely to have any negative side effect. They don't really damage your gut microbiome or your mitochondria. But herbs are complex chemically. They've got a lot of different constituents. So not only do they target the organism, a lot of these herbs are anti-inflammatory. They promote better circulation. They boost your immune system. So you might get 4, 5, 6 different actions of the plants that with the antibiotics, it just kills the bug, and that's pretty much it. So when we start mixing herbs together, again, we get a lot of different activity that they work very synergistically together. So again, most of my patients are on herbs. Low dose naltrexone, I use a lot of. I think it's a great therapy as an immune modulating treatment. Although they have yet to do any specific research on LDN and Lyme, I actually did write the chapter for the LDN network. They have a 2-volume book series, and I wrote the chapter on Lyme disease because I've used a lot of it. And it makes a lot of sense because we know it can help modulate the immune system for people dealing with chronic pain. Low-dose naltrexone. Naltrexone, the drug, actually binds to opioid receptors in the brain briefly for 3 to 4 hours. And then once it comes off, it gets your body to release your own natural opioids, which are your body's natural painkillers. So most of my Lyme patients are dealing with some element of chronic pain, and this can be an effective way to help, modulate the pain as well as modulate the immune system. And also, it's very safe. They've done a lot of research on it, outside of some people getting kind of weird, wild, vivid dreams on it. It's generally tolerated very well. And in our area, it's also a very inexpensive medication. So given the safety, the cost effectiveness, I find it's about a 50-50 with people. 50% of the people it helps, 50% of the people it doesn't do anything. But I really don't get any complaints of any horrible major side effects. And I've had a handful of people that just don't tolerate it. But I think it's worth trying for a lot of people.
So what are the top 3 mistakes readers make when trying your plan at home?
Well, I think the biggest mistake is the expectation that they're going to do it for a month and be done. That's not realistic. Again, be prepared to be in this for the long haul. And it really is about the total plan. So maybe the second mistake is that they pick one part. I'm just going to take the herbs and expect that's going to fix all the problems. But again, if you've got underlying gut issues, underlying immune issues, if you don't fix that too, the herbs may not be as effective as it would be had you done all these other things. And the third part, I guess, maybe would be if people are... I think if you're just trying to shortcut it, I'm very specific, particularly with the herbs, of which herbs to use. And although on paper it might sound like, well, I don't want to use this company, I want to use another company. Every company makes things differently. And I've got the experience of using very specific companies, specific herbs. So in my book, I recommend very specific companies for that reason, based on my clinical experience. And I've had people like, well, yeah, I took cat's claw and it either didn't do anything or it made me worse. I'm like, well, which cat's claw did you use? Well, some company I've never heard of. Well, it may not be that cat's claw is not effective for you. It may have been the way that company made it, and of course, the supplement industry as a whole is generally not regulated very well. Again, as a professional, we have access to all the professional companies that do their diligence in their manufacturing. They follow what's called GMP, or good manufacturing practices, which is kind of the natural equivalent of an FDA process of getting a drug approved. So they ensure that what's on the labels, what's in the bottle, there's no contaminants, it's shelf stable, and all these kind of things. So the quality of your supplement matters. And again, if you're trying to save a few bucks and you're going to Costco or some discount place to get it and you're not getting good results, it may just be that you need to spend the money, get a professional product, and ensure that you're getting exactly what you want to make sure that the treatment has the best opportunity to work for you.
Doctor, we are going to come to the end of this episode. So we are having our audience. And in that, 80% of the audience is Lyme patients or Lyme warriors. So do you have any messages, or do you want some message or something to convey to them?
Yeah, my biggest thing, if you're in the fight, again, you got to be sometimes your own best advocate. I've seen so many people that have been gaslit out there by other medical professionals that you don't have chronic Lyme, it's in your head, all these other nonsensical things, and it's very discouraging. So you kind of have to be like a dog with the bone and just stay at it, be persistent. And again, if you're finding things that are not working for you, Thomas Edison said, I found 10,000 ways not to make a light bulb. It means you found a way that doesn't work for you. That doesn't mean that there's not a way that will work for you. So I have some people where, we've tried 2 or 3 different treatment programs and it didn't really work. And it was the 4th one that was the right combination of what their body needed to move forward. So don't be afraid to try new things. Be wary about the really expensive things. What I find more often than not is that the really high ticket treatments that get promoted out there, and especially on social media, they're often the less likely things that are actually going to work for you. I've seen people go almost bankrupt spending thousands of dollars on treatments that are not either helpful or they only give you very short-term benefit. Often the stuff that's less expensive is probably going to be the more effective, but make sure you're in the hands, if you can, a professional to give you guidance. My book was written for people who don't necessarily have someone to do that, so it's, I think, a pretty good guide of a DIY, do it yourself at home. But if you have the opportunity to work with a Lyme litter professional, I think it'll make your path much easier.
Yeah. So that brings us to the end of today's podcast. Thank you for joining us on Lyme Support Network Podcast. So we hope Dr. Ingels' insights have provided you with clarity and actionable steps if you are facing Lyme disease. Don't forget to check out Doctor's book, The Lyme Solution, for a deeper dive into Doctor's healing approach. If this episode resonated with you, share with someone who might benefit. Be sure to follow us for more real stories from Lyme community. Until next time, stay strong, stay hopeful, and keep supporting one another. Thank you.